We're live? Hi! Good afternoon and welcome to Little Steps Facebook Live. I'm Nikki, so just before we get started, a few friendly reminders. We are live twice a month. If you wish to be reminded of our live interviews, go to our Facebook page and check our events. And you can click on the ones that you're interested in and you'll get a live update to the ones that you're interested in. We are also, don't forget to sign up to our weekly newsletters, of course, across all major cities in Asia, from Hong Kong to Singapore to Kuala Lumpur. The link is in the description, so just click on the link and you'll be subscribed. Also feel free, of course, to ask us any questions. We are live, so ask us any questions, interact with us here, and we can get back to you during the live interview. So feel free to interact. Now let's get started on our topic. So at Little Steps, one of our goals is to inform parents of any disorder that a child might suffer from. This way, parents can be better informed, understand them better, and have a more informative discussion. So, fearful and anxious behavior is quite common among young children, especially as they venture into a new world full of new experiences. However, some anxiety, some fearful behavior can be negative in their home life or at school. And so that's why today we are talking to Dr. Adler, and we are discussing all the types of anxiety and how to identify anxiety. So, very welcome back.
Well, thank you to have me back.
Yeah, I'm very happy to welcome you back.
Wonderful to be here.
Exactly. So for those who didn't see our live Facebook on ADHD, give you a little intro on Dr. Adler here. So Dr. Adler is the director of the Family Adler Center here in Hong Kong. He is a licensed psychologist in the US. He has over 20 years of experience in a range of psychological difficulties, and his expertise is actually in anxiety, with a special interest in social anxiety. So, Dr. Adler, welcome. Happy to have you.
Thank you.
You're
Again,
welcome.
it's so good to be back here.
Yes,
it's
very
such a wonderful and great time the last time, and a lot of very positive responses
I'm
to
glad to hear that.
the interview that we did before.
Yes, I'm glad
So
to
I'm
hear
looking
that.
forward to my favorite topic, anxiety in children.
Perfect. So, let's get started. Can you tell us a little bit more about yourself?
Sure. You did a nice job introducing me, but just to add a little bit more, one of the things that I'd like everybody to know, and I think I mentioned this last time I was here, is that I've been in Hong Kong for about 2.5 years, and before then I was practicing as a psychologist in mainland China for about 4 years.
Okay.
One of the things that brought me to Asia, and actually China in particular, is that I have 2 children, ages now almost 16 and 18, who are that my wife and I adopted from mainland China. So there's this a cultural connection for me
Of course.
with Asia and in China and Hong Kong in particular.
But they're not children anymore. They're all adults now.
We never want to think that as parents. They're always our children.
Absolutely. That's why my mother still calls me baby.
That's right.
So why did you wish to specialize in the field of anxiety?
Well, for a very personal reason.
Okay.
I'm interested in all kinds, and truly all kinds, of psychological and psychiatric difficulties and their evaluation and assessment. But why anxiety? Well, it's from my own personal experience. As I'd say from around 7 or 8 years old, all the way through my teens, and believe it or not, all the way through my mid to the late 20s, I was a very socially anxious young man. And I'll explain what that means in a few moments. But what happened was, it was very hard for me to make friends. I would become very nervous. And we'll talk about the signs and symptoms of anxiety in children and adolescents in a few minutes. But I was so nervous that it was hard to make friends. Asking somebody out on a date was particularly difficult for me. As well as, to a lesser degree, I also was anxious when I would have to make a presentation or go on an interview like today.
I myself was quite nervous as well and cried, and I had to turn my back often in presentations because I was too nervous. And look at us now.
That's right. And we all get a little nervous, and we'll talk about that as well. Being nervous is okay. Anxiety is a different experience for people.
So let's get started. So as usual, we are splitting up today's conversation into 4 areas. So the first area is what are the common anxiety problems, and then the second area is how to identify the signs, and then seeking professional help, and lastly, steps a parent can take at home and at school. So let's get started. So what are the common anxiety problems? What is anxiety exactly?
Okay, so what is anxiety?
Yes.
It's not just being nervous about a situation. Now, people use the words anxiety and nervousness interchangeably for the purpose of what we're talking about today, and really in common parlance and common speaking. I wish people were more clear about this. Nervousness is a normal reaction to a situation. It could be taking an exam. It could be going on a first date. It could be going on a job interview. You could probably name thousands and thousands upon thousands of experience that people have that people feel nervous. In fact, we want to be a little bit nervous because by being a little bit nervous, we become more motivated to prepare and do well.
So would you say the difference between nervousness is nervousness, you are nervous, you're feeling a sense of anxiousness, but you are still able to do what you need to do.
Able to function, that's exactly right.
Well, with anxiousness,
it's a higher degree, certainly in terms of intensity, but what distinguishes, one of the main characteristics that distinguishes, maybe the most important characteristics between nervousness and anxiety, is anxiety, it does, as you say, Nikki, interfere with your ability to perform in a certain situation, whether it be social or otherwise.
Okay. What types of different anxieties are there out there for children? I've read, as you said, social anxiety, but what other types?
There are quite a few.
Okay.
Let me name the ones that are most common statistically.
Please.
And these, just as always a disclaimer, these are based on Western statistics. That's where most of the research, unfortunately, has been done. Very little outside of Western
I've already
cultures.
got a question coming in.
Oh, wow, that's exciting.
That is
Okay.
exciting.
Should we pause for the
No,
question?
but please
Or,
continue.
let me
Continue.
explain this part.
Yeah, let's explain this part.
The ones that I would focus on are the ones that are most common, most prevalent. Certainly, what we call generalized anxiety disorder is that one is anxious about 2 or more things, and that, as I said earlier, that anxiety, and this is for children and adults, and adolescents, of course, interferes with one's function, whether it be at school, home, friendships. You can almost name almost any kind of situation a person might be in.
Of course.
So another type of anxiety, which is what used to be, you mentioned earlier, social anxiety, we now officially call it social phobia, but it's the same disorder, is that we're anxious in mainly social situations.
Would you say that's the most common one?
I'd say probably generalized anxiety disorder is the most common, but a close second is social anxiety disorder or social phobia. There's a huge overlap between the two, you can imagine.
Yes.
And the distinction between the two sometimes is difficult to tease out, just to really see the difference. People could certainly be diagnosed as both. Usually what we would do is to say that generalized anxiety disorder would be the one we would give as a diagnosis as opposed to giving both. And then for younger children, anywhere between the ages of 8 to 9 months to about 21 months, there's separation anxiety disorder, which is what the name says, having great difficulty separating from a parent, usually a mother, like for example, going to a play group without the parent, or going into preschool, for example. Those are the main ones. There's a number of different ones as well, which we can talk about as well based on the questions that we get today.
Yes, of course.
But those are the major ones that we could talk about.
It's very important for parents to know which anxiety their child has. Do you find it very important do you think parents find it very important to distinguish them in different boxes?
I think it's important for parents.
Yeah, that's what I'm trying to...
I think it's important for parents.
But as a doctor, not so much.
I think less so.
Yes.
I think it's important to identify the general area that the difficulty is in. One of the things that, I know you're going to ask about this, is how do we actually know as parents? And with adolescents who have the cognitive maturity. In other words, their brains are developed enough, and they have the skills to be able to speak more abstractly. We can have conversations about the various symptoms.
Of course.
Younger children, we just don't know.
And as we said as well before in our previous, it can also link it to other things such as ADHD,
Well, that's
depression,
exactly right.
anxiety. So then it becomes even more difficult to really
That's
identify it.
The overlap in symptoms is tremendous, and not just with ADHD, but also with other disorders such as oppositional defiant disorder, with childhood depression, which is another whole topic, but extremely difficult to diagnose. So things like poor concentration, restlessness, excessive clinginess, oppositional behavior could all be part of other disorders as well. And so by itself, those symptoms don't tell us enough. We need further information. What we also want to look for is avoidance of certain situations.
Of course. And how would you say, what is the overall prevalence of anxiety here in children in Hong Kong?
I'm not sure about Hong Kong,
Okay.
but generally throughout the world, at any one time, again, it depends on the studies and where the studies are done, anywhere between, most studies put it between 8 and 21%. Some studies put it between 8 and 40%.
Okay.
It really depends on how the studies are done, who they choose to be the subjects in the studies. It's very hard to know, but somewhere between 8 and 20%, I think, is a fair estimate at any one time.
Okay,
So-
yeah, that's a good input.
So, if you think about it over time, certain kinds of anxiety, for example, social anxiety, tends to come up more around the teenage years. So, as children hit maturity, or the children hit adolescence, yes, that they are more likely to struggle with issues around feeling very nervous in peer relationships.
Okay, so it could even be you have a child who's normally never been that anxious or that nervous, and then all of a sudden later in years they can become anxious.
That's absolutely right.
Oh wow, that's very interesting.
That's
I would
absolutely
think the child would continuously be anxious, and not that it would come later in adolescence.
Well, that's a fascinating and important point, Nikki. Studies have shown, and I have seen this before.
Yes.
I think the signs are there.
Okay.
There's less of a demand
Okay. So
to form tight relationships in peer groups
okay.
among kids who are, let's say, in primary school
Yes.
versus in high school. So I think the signs are there. It's when there is pressure and the expectation that teenagers will form close peer relationships in groups or in pairs or in whatever context, that you start to see that this becomes more of a problem.
I see. So the signs are there, but not as prevalent, and then
Or they don't affect functioning as much,
exactly.
which is when parents start, of course, to worry.
Of course. So we're moving on to the next topic. If you've just joined us, we are discussing today how to identify anxiety. I'm joined here by Dr. Andrew Adler from the Adler Family Center. And we're moving on to our second topic, which is what are the common anxiety problems? So, what symptoms should parents look for?
As mentioned earlier,
Yeah.
it's very difficult.
It's very difficult because the anxiety is so different.
That's right.
Yeah.
And each child's going to be different.
So what should parents do?
Well, it depends. I mean,
Yeah.
and it depends on the age of the child as well. You want to keep that in mind. But for children who are below primary school age, so let's say preschoolers, kindergartners, that we probably look for physical symptoms. For example, stomach aches without a medical cause, or other kind of physical symptoms where there's clearly no medical cause.
Of course.
We want to look for, as I mentioned earlier, restlessness, sleeplessness, and sometimes oppositionality. It really can cover a wide range.
So it can cover a very wide range that can be quite common in most children, and it would be difficult to identify.
That's right. What we want to look for, I think, as I mentioned, the avoidance of certain kinds of situations. Let's say separation anxiety disorder.
Yeah, let's
That's a very good one, because I know we're in the middle of the school year.
Exactly, and
but I know that some parents have just started their children at age 2.5 or so in preschools in the middle of the year. And I'm working with a few clients who are parents and children who are like that, in that situation. And these children have never been away from their parents. And some of these children we knew might have some difficulties, and they're clinging to their parents. Now, being distressed when separated from one's parents, it's not abnormal or unusual going to preschool.
Absolutely.
But when a child clings to the point that the parent can't leave without sort of blood-curdling screams and literally not allowing the parent to leave the room at all, then we have an issue that we think would suggest the possibility of separation anxiety disorder.
Well, speaking to you as a former teacher and working in kindergarten, this was an issue that arose quite often. And let's say if I would have a group of 20 children, at least 3 or 4 of those children would display those kind of symptoms. So then you would think that it would be quite common. And even though eventually after time some of these children would come around because they started trusting me, and after so many times they realized that the parents are coming back to pick them up, because often they think that the parents aren't coming back at all. But then how far does it go? Because some of these children, and especially from a group of 20, it is a very common thing that children have this fear of being separated from their parents. So when do we see that as anxiety, and when do we see that as, when do we need to see you, and when do we need to sort
of... That's
of...
right, or another professional.
Yeah.
Absolutely. I think that there's no precise answer to when one would seek professional help. I think it's reasonable to assume that many children, as from your own experience too, Nikki, are going to cry for a while. We would expect that crying to, and this is a very rough range, within a week or two, be able to calm down, develop a stronger bond, or develop a bond actually with one or more of the teachers. Usually it's a single teacher or assistant in preschool. And then the child is able to then feel calm. If that doesn't happen within a few weeks, then we start to think about, is this a real problem that needs to be addressed professionally?
That's a great thing, because I think a lot of parents, and I could see the frustration in the parents as well, that they don't know what to do with their children, and often they would take them out of the school too soon and do it at home or something like that. And how long? A few weeks is a good time to really see whether it's a problem or not.
Just as a side note, the schools, preschools, and it's not just in Hong Kong, but other places as well, so I'm not picking on Hong Kong at all, have different policies and practices when it comes to dropping off children. Some schools are really insist upon the parents staying with the child for a month or so, or even a few weeks. I think that's generally a mistake.
Yes.
I think the child is well adjusted, has a strong bond with the parent. That bond should, in a sense, transfer over to one of the caregivers.
Yes.
At, we're talking about a well-run preschool or kindergarten.
Of course.
So I think a month is too long, even a few weeks is too long. My view is actually drop off the child and leave.
Exactly. I always said, don't take him to the door, just I will take it from your car and we'll go. I
respect people come from different backgrounds.
Of course, everyone is different, absolutely.
But it makes it more challenging later on, oftentimes, to then leave.
Exactly, because once a child is already crying, it's heartbreaking for the parents,
That's right.
Of course. And then you have anxiety on both ends.
Absolutely, and we'll talk about that a little bit later on, too.
Exactly. We have a question come in. So thank you, whoever sent us the question. Could you inform us on key aspects of support for young children who have been separated from their parents, ages 16 to 24 months? This is a tricky question.
It is a tricky question. Okay. So, particular age range.
Yes.
So, children who have been separated from their parents, ages 16 to 24 months.
It's very young.
It is very young.
Yes.
This is in the midst of time when children are, we call attaching to, or bonding with, use sort of everyday term, with their parents. It starts at about 7 or 8 months for most children, and obviously goes on a lifetime, but it's still during a critical period,
Yes.
probably toward the tail end of that period. What I would say is that depending on what stage your child's at or children are at in terms of their ability to bond with you, then you would put things in place to be able to help a child make a transition or help a child be able to develop a bond with another caregiver. So let me make this a little more, make this more real,
Yes.
of course. So a child who develops a strong bond around age 7 or 8, or is developing that,
Yeah.
and showing that he or she will turn to the parent in terms of feelings of fear, danger, and can begin to, let's say after age 1 year, begin to tolerate the parent, let's say leaving the room, or somebody else, or even leaving home, let's say with a babysitter or helper, for example. Then I think the child is in better shape
Yes.
to be able to then go off with someone else and do reasonably well. Again, we're talking in general, not
Yes,
specific
of course. Every child is
cases.
Yes.
However, if a child has more difficulty doing that, or severe difficulty doing that, that's going to be much more of a challenge. I would say that if it's a more mild difficulty, what I would do is help prepare a child by doing a couple of things. First, a child should have what we would call, in sort of the olden days of psychology, or even now, a transitional object. People who've studied Freudian psychology probably have remembered this from maybe Psych 101, for
Yes.
example. Many people have taken that. A lot of those ideas are outdated, but one of the things that we do know is having an object that one associates, like a teddy bear, a soft, cuddly teddy bear,
Great
or a
idea.
bunny, stuffed animal that one associates
yes.
with one's parents.
That is a great idea.
Usually the mother, of course, and that the child can take that animal and carry it with him or her so one feels soothed.
Fantastic.
So that works well. I think also a lot of words from the parent. Now we have the video is very easy to use. Having contact with the parent through the use of video, not just audio, I think is a very helpful approach. If that's not possible, sometimes just recordings or video recordings.
Just voice recordings. for
Voice
example,
recordings
would be
too.
great
To
soothing.
hear the
Yeah.
parent's voice can be very helpful. In situations where those may not be so helpful, or the parent initially, or the child initially had difficulty developing that bond, then I think professional help is necessary to help
Okay.
the child be able to comfort him or herself away from the parent.
Perfect. Thank you. Thank you for your question.
It's a
Please-
great question.
Please keep asking us any questions. We can answer you right here, right now. So just to go again for our final question, the overlapping of types of disorders. So we said depression can be linked to anxiety as well as ADHD. How do you identify really what the core is then? If parents come to you with their child, could they have multiple things? Could they have anxiety,
Absolutely.
ADHD, and depression?
Yes. Well, as we talked about with ADHD in
Yes.
our last Facebook Live session, is that these are somewhat artificial categories. In fact, no, these are artificial categories, not somewhat. I'm understating that. These are artificial categories. These are descriptions of what we call observable behavior, what we can observe as human beings.
How long do you need to observe a child before you think you can make a fair assessment?
Probably a few years. No, I'm kidding. Well, that's a very good question. Because if you think about, let's say for something like generalized anxiety disorder, you'd want to observe in multiple settings.
So at the school, at the home, at the...
And that's right, exactly right. And because young children in particular are not as stable in terms of their behavior. I'm thinking behavior more generally, how they act toward other people, how they show their emotions, how they follow directions.
Of course.
Even a couple observations, let's say done in 2 different settings, may not be enough because it may not be a typical day. So yes, at least observations in a couple different settings, interviews with caregivers and teachers, obviously parents as well. And we're talking about young children here. With older children, we can interview them.
Mm-hmm.
And I do quite a bit of that.
Okay. And how did children respond to it? I imagine myself as a teenager, it can be quite difficult to speak to someone who is not in your surrounding family, who are not your friends, and feeling that you're getting forced to go to see a psychologist.
And that
is
happens all the time.
So how do you break through,
Okay.
break that the barrier?
One thing that I have found out from many years of practice is to acknowledge the difficulty to the teenager.
Yes, I think
And
that's
how
a very
hard
important.
this is. Earlier in my career, I used to say, I would have trouble doing the same thing as well, but, teenagers tend to be a little bit egocentric, and they're not really interested in your experience so much. I'm interested in my experience. They may not be.
Yes, exactly. It's all about them.
All about them. So I say, I know how difficult this must be.
Yeah.
And you're pleased, you're glad that they're there talking to you,
Okay.
even though they may feel forced. And I will often ask, how do you think I can be of help to you?
I think that's a good question that parents could ask their children as well when they're going
I
through
think it's excellent, Nikki.
Yeah.
Even before the first appointment.
Exactly.
A lot of times, I will talk with parents. When I do a fuller assessment, I'll meet with parents first.
Yes.
And I'll give them guidance about what to say to their teen or younger child.
Mm-hmm.
And I know parents have a lot on their plate. I remember when my kids were younger. And it's very difficult to remember everything.
Of course.
And parents, especially in Hong Kong, feel very rushed, whether they should be or not. They feel very rushed. And they forget to prepare their child.
Exactly.
Even though they agree that it's such an important thing to do. But that preparation is so important.
It's key, yes, absolutely. So for those who just joined, we are doing a Facebook Live on how to identify anxiety. I'm joined with Dr. Andrew Adler from the Family Adler Center, and we're moving on to our next topic, which is seeking professional help. So when should we seek professional help? We've already kind of touched this, but how young can we identify anxiety in a child? We've here discussed 16 to 24 months. Can it be even younger still?
It can be, but with a lot of caution.
Okay, yes.
So separation anxiety disorder is a little, I keep coming back to that because it's probably a little bit easier to identify. Not to be too repetitious.
Yes, yes.
But again, if a child is not able to soothe him or herself after being in preschool for several weeks, I would start to worry, and that would be a great time to seek professional help.
Okay.
It's more difficult with something like generalized anxiety disorder, or even if there's the beginning of, let's say, although it's less common, because it's less hard, well, not less common, it's harder to detect, social phobia.
Yes, that was social anxiety that now been it's been changed to phobia.
That's right. So it's in terms of diagnosis, but most people still call it social anxiety disorder, which is much better.
For parents who are looking,
it's a much better and accurate label.
I agree.
Those signs are sometimes harder to distinguish. It's hard to know. There are many reasons why kids might avoid other kids, for example, on the playground. And one of the things that, it's not just social anxiety, one of the things that's difficult is that when, for example, kids have and this probably relates more to generalized anxiety disorder, but it could be both. When kids have difficulty participating in class activities, is it because they're experiencing anxiety or because they're really struggling with, let's say it could be a communication skill, their speech and language skills could be delayed, or in terms of their early developing, we call cognitive skills, being able to make sense of what they hear and process that information.
Of course, and what about, let's say, if you have dyslexia, that could cause an anxiety, let's say.
That's exactly right.
Yeah, so one thing could lead to the other.
So we just been called psychosocial assessments. And this is beyond the scope of what we're talking about today. We could probably we should probably actually do a whole Facebook Live on this, and because a lot of schools will recommend those to parents and parents say, what is this? Why does this cost so much money?
Yes.
But in those kinds of assessments, we want to look at those kinds of issues. What is the primary issue? Is it primarily for something like anxiety? Or can we call it ADHD? Can we call it depression? Or is it more the result of having a learning disability?
Exactly.
Or something of both? I mean, it's impossible to come up with a complete, accurate picture. We want to come up with the best possible picture we can.
Okay.
I didn't mention another kind of disorder as well, which I do want to bring up, which are specific phobias, which would be phobias to, let's say, insects, or very young children
Cleanliness.
Cleanliness.
Yeah.
Well, let's get to that in a moment. But things like, for example, fearing that there's a ghost hiding in the closet, or there's a monster under the bed. You see those in very young children. But if a child still experienced that at the age of 5 or 6, then we need to be worried.
Okay, so even at 5 and 6, if a child is unable to fall asleep because he or she is terrified and sure that there is a monster under the bed, that at that age we should already be concerned a little?
A little concerned, yes,
Okay.
especially if it's not just transient, if it's been going on for several years.
Okay, it's going on for several years. Yes, I understand.
Often it's not clear cut. It doesn't hurt to seek a consultation just to find out whether this is a problem that's worth pursuing further.
This goes on to, thank you. This goes on to my next goal. Well, we'll go with Michelle first. So hi Michelle, thank you. I would like to ask you your opinion on the tapping method for anxiety. I'm not clear, I'm not sure about this tapping.
And I'll be honest, because I try to be as honest as possible. I don't know what that is, but I will look that up.
We will look that up, Michelle. If you wish to ask us another question or kind of tell us what the tapping method is.
And I can also get back to you later on. I'll be more than glad to do that.
All the details are down below, and we have somebody on Facebook also checking in with you if you need any further help. Thank you, Michelle, though. So moving on to the question that I want to, how do we seek help? Where do we seek help? So do we only go to psychologists, counselors? People have different types of budgets, people have different types of backgrounds, people have different types of cultures, some find it more difficult. But if the parent thinks that the child has anxiety, where should they seek help?
An excellent question again. Like most areas when it comes to psychological or mental health issues, there's not necessarily a clear-cut answer. I would say that you want to seek someone who works with children and specializes in working with children. So for example, I work with children, I specialize in that area.
Yeah.
Anxiety is my main area of interest, especially for social anxiety, but I do work with some adults.
Okay.
However, children are my focus. I would not go to someone who specializes in adults if I were a parent who is a child with social anxiety, even if that person is highly recommended.
So finding somebody that works with children is key.
That's right.
Okay.
That's right.
Regardless of their background, just is that we know that they are comfortable with working with children.
Yeah, that's exactly right,
Yeah.
Nikki. The question is, does one go see a psychologist or a counselor or a similar kind of
or somebody
therapist
from school?
or somebody from school? Usually the counselors from school, and we're actually blessed now in Hong Kong to have schools that have really invested money into hiring counselors, in some cases psychologists, who are getting better and better also when we're working with people like myself who are not part of the schools, who are in the community. Usually those counselors get involved in areas that are more, that impact more school functioning.
But that's usually the private schools and international schools.
That's
when we talk
correct.
about public schools in Hong Kong, it's trickier.
I don't want to offend anybody.
No, but it's
But I will be quite honest, in the public schools, if this gets me into a little bit of trouble, so be it.
We apologize.
No, it's actually a very big topic. Public schools, or schools that are partially or fully government funded, because there's all different levels of what I've learned over my 2.5 years here, that they will typically be assigned a social worker from the government. I have big questions about the training and expertise of a lot of these social workers, and they also tend to work, from what I gather, for NGOs, and they often move around a lot. So for example, working with a boy who's autistic, who I did a full evaluation on, he was very attached to the social worker went to one of the top private/public schools in the city. And that social worker left because she was fed up with, I guess, working through an NGO. And this boy, who develops very few relationships or connections with anybody, is struggling now
Yeah, because she left.
because she left, that's right.
Yeah.
So, not that one shouldn't go to a school counselor.
No,
But
absolutely.
I think international schools are better set up right now to address those kinds of issues.
Perfect.
Outside of international schools, I would say if a problem seems to be fairly mild, you could start with a counselor or a psychologist. But if the problem seems to be affecting, it seems to be more severe, which is really a very subjective judgment, and affects the child's ability to function significantly, and again, it's a very subjective call,
Of course.
in major domains like academic functioning, social functioning, then I would say that one goes to a psychologist and gets a full evaluation. And you might end up seeing, the child might end up seeing a counselor afterwards, but doing that assessment is so critical.
Okay.
Because the earlier you can catch problems and understand the relationship, say, between academic functioning and anxiety, the better it is for the child in the long run.
And what types of, once anxiety has been assessed and diagnosed, what types of treatment are there for, does that differ for the child?
Depends on the age of the child and the kind of problem, obviously.
Mm-hmm.
So, for a younger child, they don't have the speech and language skills necessarily to be able to talk about the problem,
Mm-hmm.
and we'll talk about that in just a moment.
Yes.
And they also don't necessarily have the brain hasn't developed to the point where they can deal with some of the slightly more complex issues that go along with working themselves on certain kinds of therapeutic approaches.
Okay.
So it's really left to the parents, and also looks like to the teachers as well,
Mhm.
and other caregivers too, of course. What's important is to give the child confidence that he or she can get through a situation. That he or she can get through a situation. So for example, being afraid, for example, to
Go to school?
go to school. Yeah, okay.
Yeah,
Go to
good.
school is a great one.
It's a big one.
That you know, to empathize, saying, I know
Mhm.
how difficult this is, but I know you'll be able to do it. I believe in you. I have confidence that you can do it.
But there are days where they go, where the children go to school, like everything is fine, and then they'll go back to their anxious behavior. It doesn't.
That's right.
Doesn't always.
That's right. And sometimes we don't know why that is.
Okay.
One of the things I would do then also is that when a child is demonstrating success, I would praise the child and really be very positive and be very specific in praise. I love the way you went to school without even my talking to you today. You were really good about doing that.
Great idea. And you should get every family member involved in that. With the brother
That's
and
right.
sister,
That's
not just
right.
the mother as well.
That's right.
That everybody gets involved.
It's so hard for parents because you don't want to call too much attention to the problem.
Of course.
There's a limit. You have to know your own child. And that's where sometimes professionals can be of great help in terms of being able to decide how much is too much.
Yeah, where does the line lie for a parent? How do they distinguish that he or she is just not wanting to go to school today or actually anxious about them? Because I bet also children might want to take a little bit advantage of theirs.
That's a very good point. That's a very good point.
If you've been assessed with
Yeah.
anxiety, I mean, I sure would if I was a younger.
You run the risk of that.
That's true.
But I would say that the risk of a child remaining or becoming more anxious is probably a greater risk
Okay.
because anxiety problems can certainly get worse over time.
Yes.
When it comes to older children, we can do things that we can't do with younger children because of their communication and their cognitive, their skills. One of the things that we will often do is that we do a lot of cognitive behavioral therapy. In this particular situation, what we might do, for example, say with a child who is afraid to go to school, what we might do is something we call exposure, but do that gradually.
Okay.
So for example, if a child typically, let's say, walks to school with a caregiver or with a parent, you might not go all the way the first time. You might walk part of the way, the child knows this in advance,
Yeah.
and then you walk back home.
Okay.
Let's say you do a little
Just
bit
little
more.
by little.
It is frustrating for a parent.
I can
It's
imagine.
important for a parent, I know how hard this is, not to betray a sense of anxiety. And I know parents, how anxiety-inducing this can be for parents.
Of course, of course. We've got a question from Jessica. Thank you, Jessica. Does a child with anxiety tend to have night walks or sleepwalking? I imagine she needs.
There is probably a connection between the two, but
Okay.
I'm not aware necessarily of a direct connection between the two.
Fantastic. Thank you for your question.
Just think about night walking it's actually fairly common. As long as, I think you want to make sure that the child just remains safe and is not going to go into a place that is going to cause danger. I know it's hard in Hong Kong with apartments. We don't even have doors in some rooms.
Windows in some
windows. So it's a challenge here.
Yes.
But we can only do the best we can. We
Of
cannot
course.
be perfect
Of
at
course.
all.
So we're moving on. So for those who just joined us, we are today talking about identifying anxiety. I'm joined with Dr. Andrew Adler from the Adler Family Center. And we're moving on. We are now talking about steps a parent can take at home and at school. We're already in our final bit of the interview. It's gone quite quickly already.
Yes.
So please
I'll be glad to stay all day if you do this. You could go on with more questions and
ask us any more questions. We are live for the next 10-15 minutes, so if you have any pressing questions, now is the time. If not, we can always come back to you. So now, what steps can parents take at home? What can we do, what can a parent do to reduce a child's anxiety at the home?
so it depends on what, of course, the nature of the
Depending on the
anxiety.
anxiety, exactly.
So, for example, in
So let's not do the separations, let's talk about a different type of anxiety
yes,
that can be at home, that is very common
Okay.
at the house. Let's say an anxiety for insects or for certain things, or cleanliness.
okay,
There's
okay. So let's talk a little bit about obsessive compulsive disorder,
yes.
and briefly because it is somewhat more common among older kids, but still overall, it's not all that common. In general, it's a problem though you probably want to seek professional attention for.
Mm-hmm.
So obsessive compulsive disorder is that there's a fear of something
Yes.
that one then becomes literally obsessed about. And so, for example, and again, what's hard is that it's not a direct relationship between the behavior and the fear.
Tricky.
So we often don't know what the fear is.
Okay.
But the behaviors that result is that a child becomes obsessed about, let's say, cleanliness. Now, it may not be that the issue is cleanliness, but this is a sort of classic
Yes.
example. But that the child has a compulsion then, a behavior to wash his hands over and over and over again. So in that case, I mean, that becomes a more serious issue. Again, I would suggest seeking a professional consultation in that situation. I think, though, that if you start to see that kind of problem, again, the same thing what I mentioned earlier is that you want to assure the child that the child is going to be able to get through the situation, and you understand how difficult it is, and that you want to create an environment of openness where the child can really tell you what's going on.
Yes.
You may not get at what actually is going on in terms of the behavior or what's behind the obsessive and compulsive
But they're
behavior.
talking about it.
That's right, so they feel heard.
Mm-hmm.
Another example that might come up from home would be studying for an exam. It's a huge topic here in Hong Kong.
Too many
Of
exams.
Children, especially locally, of children of any age.
I know. As a
Yeah.
teacher, I know. I've done the exam.
Yes.
It's mad.
So the anxiety begins as one is studying, for example.
Mhm.
Not only telling the child that you know the child will get through it, but also praising the child. When the child is saying, I don't think I can do this, is pointing out areas of strength, of accomplishment more specifically, where a child has actually been able to demonstrate success in something.
Okay, yes.
And from that you can say, well, I know you were able to do this, and you did this, not able to, you did this, now I know you can do this.
Exact, step by step,
That's
giving them
right.
reassurance, rewarding what they've already done, and then kind of focusing on the next step. Let's
That's
say.
right, that's right.
What if I this was not on my spot. Now that I'm thinking about, what advice would you give parents actually? If their child has anxiety, I'm sure that parents can feel rather stressed as well. And how to deal.
That is true.
How to deal with their anxiety.
Anxiety is contagious.
Yes, exactly.
Within families. It's quite contagious. And parents are, first, let me make this clear. Parents are not at fault. Anxiety is very contagious.
Yes.
We want our children to do well. We love our children.
That's all we want.
We want them to do so well. And we see our child struggling. It makes us anxious.
Of course.
It makes us nervous, and then probably, for many of us, anxious if we see our child really struggling.
And how do we deal?
For ourselves, we take good care of ourselves. For
Yes,
one
it's
thing.
very.
If it's affecting us to the point that we're not able to function well as a parent, and that's a hard thing to assess, then we would seek professional advice for ourselves and our children,
Yes.
or at least get a consultation in that area. But it's very important because parents are the most important teachers.
Of course.
Teachers are so important as a
no,
former
but
teacher,
parents
but parents are the most important ones. And so we need to look at what, ourselves as parents in terms of what we demonstrate and model for our children.
So with the advice of counseling, would you advise family counseling sessions so that parents and the children can be together and really address what is going on?
It depends on the age of the child in
Okay.
part, and depends on the nature of the problem
Of
itself. I think even if a full psychoeducational assessment is not conducted, a good counselor or psychologist will do a basic assessment. Understand, is it a problem that's best addressed by the family or individually? How much should the parent be involved? How much should the child be involved?
Yes,
and that can change over time.
Yes, tricky, very difficult. I feel my heart goes out to parents who have children with anxiety. It must be very difficult to cope with on a daily.
It certainly is.
Yes.
It certainly is.
We have another question from Jean. Thank you, Jean. What is the likelihood of a child with anxiety issues maintaining an anxiety disorder as an adult? Great question.
Okay. If it's untreated, it's fairly likely that it will continue as an adult.
You can speak out of personal experience.
Yes. Through my late 20s, maybe even 30s. It's very easy for it to continue. Because it relates to what we were just talking about, Nikki, is that it's so hard for parents to deal with their children's own anxiety. That a lot of times parents just feel like they're not able to deal with it. They're just trying to deal with issues, getting by in everyday life.
Because it's difficult. With depression, you can better understand. With anxiety, the result of the child and how the outburst can be so unnatural for a mother or father to see that they don't seem to understand. Whereas other disorders seem to be more easier to understand.
That's right. So yes, it can often lead, I don't know the exact figures in terms of following individuals across time. It's a hard study to do because you really have to be able to diagnose correctly at the beginning and then diagnose correctly as you go along.
Yes.
But certainly a lot of anxiety goes into adulthood, especially if it's untreated.
Thank you for your question. So we're already on to our last question. So how do we inform schools? Do we inform the schools that our children have anxiety? How do we help our teachers in our schools in addressing a child that has anxiety?
I always encourage parents to be brave and to tell teachers. One of the things that's so hard though is that we deal with different kinds of teachers are individuals as well with different degrees of understanding, beliefs about mental health issues, and rightly so. A lot of parents are reluctant to talk with their teachers. One of the things I find helpful is that there's a counselor in the school, and hopefully there is, or someone who could act in that capacity, let's say in administration. I might talk to that person first.
So you would bypass the teacher?
Well, not so much bypass the teacher.
Not that I mean
in terms initially to see, would it make sense to talk about this with the teacher?
Or the principal? Would you go directly to a higher authority or the counselor?
I might do that. I might actually, again, each school's different relationships.
Of course, and you have a different relationship with your teacher.
I think ultimately you need to tell the teacher.
Yes.
I believe that, and I know why parents are reluctant to do that. That, we know that if a child is labeled correctly or incorrectly with a diagnosis, the child is treated differently. But I think teachers can play a huge role in doing very much what parents do.
Absolutely.
They can both empathize with the child's distress around his or her anxiety.
Diffuse situations very quickly.
Diffuse situations. Well, you don't want to diffuse them too much. And that's an important point that we haven't talked about, is that you don't want to protect the child from anxiety.
Can we go a little bit deeper on that?
Yes, because if you protect a child from anxiety, you are depriving the child of the experience of actually being able to cope with it.
But you wouldn't push your child into situations of anxiety either. But
Not,
a little
not with the intent, not intentionally, no.
No.
But if your child is anxious, they will come up,
Mm-hmm.
both at home and in school.
Mm-hmm.
And one of the difficulties that parents and kids get into is that parents, of course, want to protect their kids and will engage in, we call avoidance behavior, helping the child avoid
Of course.
situations that might make the child anxious. For example, we haven't talked about this, but for example, agoraphobia, being afraid of being in places that one feels one can't escape from, like a crowded shopping mall,
like a claustrophobia.
or escape from Hong Kong,
Yes,
for example. So if you avoid those situations, the child then is going to learn that if I avoid it, I don't have to face it. And so we don't want to do that, but we want to help remind the child that he or she will get through it, and you're there as a parent or teacher to support that.
As teachers, do they need to take certain steps? Would you argue that the teacher should make it to normalize it as much as possible? Their anxiety, let's say if a child has an outburst in the class, what should a teacher do? Should they focus on the child, take the child out of the classroom? There's more children, because people with anxiety can often have outbursts as well of real anxiety that they cannot be in the classroom. What should a teacher do in such a situation?
I would not call attention to it.
Okay.
Unless it's so severe that the class can't continue.
Of course.
I would not call attention to it, because you're then risking the child becoming more anxious.
Okay.
I would take the child aside afterwards, once everybody else is gone. Not announce, I need to speak to Johnny.
Yes.
And then the kids are aware that
Mm-hmm.
something wrong or something special is going on here, and maybe nothing so positive.
Mm-hmm.
But I would talk to the child
Okay.
at the end of the class.
And when you said that during a diagnosis you would often want to go into the classroom as well,
That's right.
how does one speak to the schools about that?
Very directly.
With public schools, I can imagine here in Hong Kong it could be more difficult.
So far, they've not let me in.
Exactly.
And I find that a major problem.
Yes.
I thought coming from mainland China to Hong Kong, to be quite honest, there'd be
A massive difference.
Big difference. Not much of a difference. And it's very sad, I think, for a lot of children here who
Absolutely.
attend more local schools here, and I think that needs to change.
Till to this day it hasn't changed, so how do we cope with it outside of that? So you are not allowed in the school, so then what do you do then?
Well, to be quite honest, the evaluation or assessment is going to be more limited.
Yeah, I can imagine.
It's going to be more limited. For example, one of the many parts of an assessment is having teachers fill out questionnaires, which would provide another source of information about a child. In public schools or schools that are publicly funded or local, most schools will not allow that.
No, exactly. Which is
And they're
frustrating.
very controlling over that, and I wish that would change. I wish Hong Kong were different in that way. But it's not that different from mainland China in that respect.
Could you even advise a parent to maybe, if they have a good connection with the teacher, to have a drink with the three of you in a cafe potentially, so that even though you are not allowed into the school, that you can at least talk to the teacher? Have you ever tried such a thing?
No, I haven't. Partly based on the experience I had a while ago.
Okay.
Where, without going into details, because I would never want to identify
Of
a client,
course.
but the father of the child actually taught at the school.
Ah, yes. So there is.
So even then, that was not enough to be able to help the school do something a little bit different, which would be for me to be able to make contact with anybody at the school.
Of course.
Which was sad, very
It
sad
is
that we
very
couldn't
sad.
do that.
So we have come already to the end of our interview.
Unfortunately.
Yes. Have you have I not asked anything that you might wish to expand on, or do you wish to bring something up that I may not have asked?
I think you've covered quite a bit, Nikki, and
Fantastic.
you've done a wonderful job.
Great, thank you.
And I encourage parents to, if you're not sure about something, to seek professional help. It could just be a consultation, a one-time meeting. It doesn't necessarily need to be years and years of therapy or counseling. A one-time consultation to better understand what's going on and whether you should do something different. Sometimes there is some practical advice that we can give, and other times we might make some other suggestions that could be helpful.
Perfect. Well, thank you all for listening. Thank you all for coming in and asking the questions. If you do have any other questions, we can come back to you even though we're not live anymore. So feel free to ask us any questions and we can get back to you. We are live again in February. In the second week of February, we'll be going over to the Malvern School. So very excited for that, and catch us live in February. Everybody have a great Chinese New Year. Bye.
Bye-bye. Thank you.